Have you been injured, thought you had just a pulled muscle, and you're not getting better? Have you wondered if something else might be going on? Hi, my name is Dr. Matthew Collins, and this is a common question that we have when we see new patients in our clinic. The answer to this question is yes, there might be something else going on. Before we begin, let me remind you, these videos are for informational and educational purposes only. They are not a substitute for chiropractic or medical advice, for diagnosis, or for treatment. So let's jump into this topic. When the spine is injured, the muscles are very close to the skin, there's a lot of nerve endings, and it's very apparent if there's spasm in and around the area that hurts. And so it's really easy to start with a muscle injury and stop there. However, there are several different tissues underneath the muscles that can create a lot of problems. So the three primary tissues that can be injured if there is a spine that has been damaged is number one, the bone. You can fracture the bone. Number two, you can injure the disc. And number three, you can injure the connective tissue or the straps called the ligaments that hold the bones together. I've got a model right here. I'll just demonstrate it to you very quickly. So with this plastic model, you can see that here's the bones. You can crack these. This right here is the disc. It is a soft piece of material that allows the joints to bend and move. And then on the back side, you've got these ligaments right here. So you see where it's yellow here and yellow here, those are ligaments. You can tear those, and this right here is an inflamed ligament. And then you also have muscles. These are pieces of muscles right here. So having a thorough evaluation that has the necessary imaging is really what is critical to identifying which tissues are damaged. Very briefly, I'll summarize it this way. Most imaging modalities that are out there can identify if there is a bone that has been fractured. That would be X-ray, CT scan, or MRI. If the disc is suspected to have been damaged or injured, the best one for that is the MRI. In certain cases, you can use other modalities, but MRI is really the gold standard. And then when it comes to the connective tissue, when it comes to the ligaments, you can use MRI for that, but it's not as valuable as using X-ray. We have another 4-part series on ligament injuries. I recommend you go take a look at that one. But it all starts with a physical exam. You know, having a very thorough history, having a very thorough physical exam, and then ordering the appropriate imaging by a doctor that has the training and credentials and the experience how to diagnose these injuries is really what is critical in order for you to make progress. So if you're not getting better, it could be as simple as you just haven't had a thorough enough workup. Thank you for watching this video. You have a lot of videos that you could watch. I'm honored that you chose this one. I hope you found it informational. And if we can ever help you, please feel free to give us a call. Thank you very much for your time and have a blessed day.